Critical care doctors in our state warn if the COVID outbreak gets much worse, the state may have no choice but to declare crisis standards of care, a situation Washington has never seen before. It would mean systematically rationing care for patients because supplies and space are so limited. At Overlake Hospital in Bellevue, critical care doctor Todd Freudenberger sees it all. And for the first time, he's giving us rare insight into how close we've become to the ultimate healthcare emergency. Crisis standards of care has not been declared in Washington state, but it has been in Idaho, this sort of rationing of resources. How close are we to that actually happening in your view?
I think we're like on a razor's edge of close to that. I think we're kind of leveling off. So I'm hoping that that we've seen the worst of it. When you hit crisis standards of care, then everybody gets substandard care.
Is it scary to know that that's actually a possibility?
It's very scary. Very, very scary.
And how much more can a staff take? It sounds like you're facing, some people are facing burnout.
Yeah,
are you
absolutely.
You're experiencing
that?
Oh,
100%. Yeah, I see it more among our nursing staff, and so they're exhausted. I mean, they are really exhausted. I've never experienced anything like this as far as the amount of stress on a particular staff and the amount of burnout that people are facing and fatigue and where resources just seem so scarce. I've just never encountered anything like this. So.
Do you see any light at the end of the tunnel at all?
Yeah, it's just a long tunnel. We just know that we just have to, put our heads down and move through this because it's our job. It's what we think we were put here for.
Yeah, he and his staff never thought they'd be going through this now fifth wave. As he sort of put it in the piece there, hospitalizations do appear to have plateaued a little bit in the state. Deaths, of course, still a major problem. We're way, way higher than we have been in recent months. One thing that struck me as well was what he told me about his staff having to endure verbal and sometimes physical abuse from some of these patients that come in, some of them demanding they want ivermectin or they want this kind of treatment that they know nothing about, and the doctors say, we just can't give you these things. But they seem to, as he put it, have a political sort of slant for a lot of these folks who are just getting, abusive with the staff, which nobody wants.
In addition to the fact that they're already exhausted coming in and trying to maintain
over again.
good patient care, which they're dedicated to.
Yeah.
It's tough to do that every single day, for sure.
Exhausting.
It's important that we tell these stories, though.
Yeah.